Hello, welcome to this WACOS Community Sector Recovery webinar. We're here on Whadjuk country as part of the Noongar Nation, and it's traditional in Australia to pay respects to our elders, past, present and emerging. So I'd like to acknowledge First Nations people right around this country and also overseas, because I know that we have people from other countries joining us. So welcome to everyone. My name is Helen Creed and I've got the pleasure of emceeing today's webinar. These webinars that WACOS, the WA Council of Social Service, which is the peak body for the community sector here in Western Australia, are providing an opportunity for further sector engagement and input, informing the advocacy and work that WACOS does, ensuring that we've got an inclusive recovery response for all Western Australians. The weekly webinars that WACOS is having build on the recommendations put forward by WACOS and some of our key sector partners, and include the insights which have evolved from the experience that we have had during the COVID-19 pandemic. This webinar, however, is a little different. It's called Connecting to Secure Healthy Food for All Western Australians, and it's the first of a two-part series where you will have the chance to learn about the collaborative approach that we have taken, business, government, unions and universities and the not-for-profit sector to develop the WA Food Relief Framework and the Food Stress Index, a tool that is regarded as a world-first innovation to address the challenge of food insecurity and ensure fair food for all. This has been especially true since the onset of the pandemic, when agile and adequate charity food responses have been critical for existing and emerging groups impacted by COVID, who are relying on relief services. We obviously have a formal set of presentations that we'll be providing to you, but we also want to invite comments or questions from you. And you can do that by typing the question directly into the chat function at any time during the presentation, and we have allocated time during the presentation to respond to those questions. I'm sure after months of Zoom meetings and these sorts of webinars, you're all very familiar with the approach, and also please use the chat function to alert us to any issues or difficulties that you're having. So without further ado, we'll get into the substance of today's webinar, and we'd like to start off with a brief video presentation for you. This introduces the WA Food Relief Framework. It was funded from contributions from a combination of direct and indirect providers, and features people with lived experience of food insecurity. And that is a very important component of the work that we do. Those people with lived experience always at the forefront, so that we are very focused on what our work is all about. Due to the numbers of participants on the webinar, there might be a slight delay between the video and the audio, but from our testing of it, it seemed to go okay. So please just spend a couple of minutes watching our video. Thanks.
If I've got bills, then it's one or the other. I can either eat or I can pay my power bill. And if I don't pay the power bill, then it snowballs. So it gets out of hand.
I was working, I was only on minimum wage, but still be just times throughout the week where I've had like no money for the missus and the kids, to the point that we can't afford to buy food, and bus fares, just general cost of living is just through the roof.
Sometimes I skip meals, or I even go to families that's got food, but I don't have any food, or any families.
To meet this demand, the sector came together to develop the food relief framework. So we really identified the problem and looked for solutions. We undertook extensive consultation to understand the nutritional, cultural and social needs of people who are receiving food relief.
When I stayed on the streets, I had to go and access centre care for some food, just like a food pack.
Thank you very much.
Struggle doesn't discriminate, so I think everybody goes through it at one point in their life, and everybody's going to have to experience it, and if you don't, then you're really lucky, and you should probably try and help others.
A lot of people are using the service, and if there's a line of people, well, they can only get half the line, and that's unfortunate to the other half that miss out.
Families that need to spend 25% or more of their weekly income on food are at risk of food stress. So what we did was we mapped these across Western Australia, and the high-risk areas are shown in red.
One of the key findings of the food relief framework was that the food relief sector cannot address food insecurity alone. We need the commitment of a diverse range of stakeholders to work together to help us do this.
I've learnt to swallow my pride in that regard, but it can be upsetting that I'm not supporting myself. At 44, I feel I should be able to stand on my own 2 feet, and that will come in time. But at this point in time, I have to access help. Without that, I don't eat.
And you can see there in that last slide that's up the different organisations that were involved in the production of that video. It sets the scene for us today, and you'll hear from several of the people who are in the video. And first up is Jenny Gray. Dr. Jenny Gray is the Deputy CEO of the West Australian Council of Social Service. WACOS was the peak body nominated to auspice the food relief project that started late in 2017, and where the idea for a food stress index was formulated. I'm now going to ask Jenny to give you an overview of that project. Jenny.
Yeah, great. Thanks, Helen. As the slide shows, this project actually began in 2017 with a roundtable that Lottery West actually convened. They asked providers to come together to look at how we can improve the efficiency and effectiveness of the delivery of charity food in Western Australia. Those stakeholders that were invited to that initial roundtable were in furious agreement that that's absolutely what we needed to do. So the impetus for the food relief framework came from the sector itself, and we established a working group to oversee that work. We engaged a range of providers and consumers, retailers and corporates from around Western Australia, and we asked quite simply what's working well, what isn't, and what can we do differently. Our consulting team, Lockie McDonald and Leela James, spoke to 150 food providers in 15 different sessions, again around Western Australia, and in addition to that hosted some workshops with people with lived experience to get their input as well. What we found is probably not surprising to most of the people who are listening. Food relief, the need for food relief and food insecurity is entrenched. It is actually not likely to be an emergency. We found that people on average experience food insecurity for 7 years. And despite the very best efforts of services, food relief providers really struggle to meet the social, cultural and dietary preferences of those who are receiving food relief. We found that there was logistical gaps around Western Australia. Again, no surprises to anyone listening in, that there's no infrastructure outside of Geraldton and Kalgoorlie to assist in the transport and storage of food relief. We found that the provision of food relief sits outside of the provision of other and related services, and as a consequence can be siloed, that there was no policy integration with those and other services, and there was no way to measure the outcomes of the services provided. Were we making a measurable difference in the lives of people who were accessing food relief? Most of the measures related to inputs and outputs. Following all of this work, we drafted some solutions, and we convened a think tank of representatives from all around Western Australia to give us further input into refining those solutions. Next one, Ashley. The process of undertaking the development of the food relief framework actually started to generate some early wins. So the process of connecting people from different segments in the food relief service system meant that these stakeholders could start designing particularly local solutions through the brokering of those local partnerships. We produced the report, which again many of you will have, and which was launched last year in September. In that report, we included the mapping of services by regions, and in that mapping we included who are the local stakeholders, is there a network that already exists, and what are the particular strengths and challenges in that region. We developed a range of code of practices, including good practice principles, best practice principles for service providers, and a charter of consumer rights for those who are receiving food relief. We developed a range of toolkits, including a policy toolkit that enables and enhances the engagement and input of those with lived experience. We enhanced some of the WACOS platforms like WA Connect, and we're in the process of developing an adjacent platform to facilitate the connection of organisations with surplus food with those who need it. We developed a range of training packages to orient service provision towards more person-centred and outcomes focused. And this work generated a lot of interest across the sector. And importantly, we developed an index to measure and monitor food stress, which Tim and Christina are going to talk to very soon. This culminated in the Premier's Roundtable with key stakeholders from not just the community service sector, but the commercial corporate sector as well. Unbelievably, that roundtable happened in the last week of February, just pre-COVID. It seems like such a long time ago. We were very fortunate that it happened when it did, because we have been able to leverage some of the partnerships since in coordinating our responses to address the impact of COVID. And probably the Clearinghouse is the main response that would be good to mention now. So the Clearinghouse is a group that was convened to meet weekly to marry up the supply of charity food with those areas most in need. And since the onset of the pandemic, the Clearinghouse has coordinated the distribution of 92 pallets of food across 13,000 kilometres to over 55,000 people who were rendered food insecure as a result of the pandemic. And probably just to conclude, that this work has generated a lot of interest around Australia, and lots of other states and jurisdictions are looking on very keenly to see what we're doing.
Thanks, Jenny. And the slide that was up as you joined this webinar was in fact taken at the Premier's Roundtable. West Australians on the hookup will no doubt be able to recognise a number of their colleagues and people involved in this area from that slide. Jenny has given you that overview. of the project, and we now want to look a little more closely at the concept of food security, food insecurity. And I'd like to now call on Christina Pollard. Christina is the Associate Professor of Public Health Priorities in the School of Public Health and Director of Public Health Advocacy Institute WA, and is based at Curtin University. Christina has been involved in the food relief project from the beginning, and she supervised the design and development of the Food Stress Index. So over to you, Christina, for an overview of food insecurity and how this connects with our work to address food stress.
Thanks, Helen, and hello, everyone. At the very beginning with this group, it was really important for us to actually define the problem that we were responding to. So there was quite a lot of work done to look at what is food security, and the definition you have on screen is likely, with the exception of culturally acceptable food, we're looking at routine access to safe, nutritious and affordable food to meet the daily needs of people in socially and culturally acceptable ways. One of the problems that we hit on very early is that the government data in Western Australia is not done routinely, and it probably doesn't give us the extent and severity of food insecurity. So about 5 to 10% of households in Australia are food insecure, and up to 50% in very remote communities. So we knew that there was a geographical element to food insecurity in this state. There is some other research. The University of Western Australia has identified in the 100 Families project that looks at entrenched disadvantage and families' responses, that 80% of adults in those families had low or very low food insecurity, and 67% couldn't feed their children a balanced meal at some time in the last period. So we know that food insecurity was likely to be underreported. Also, we had a lot of discussions around what's the relationship between food insecurity and the need for emergency food relief. And in Western Australia and in Australia generally, the response to food insecurity is through the charity sector, with some government funding, but a lot of public donations. We, at the time, were looking at scenarios, so 6 to 100% of families, 6% being what our Australian Bureau of Statistics data showed us, is the proportion of people who are financially distressed, who are likely to get in contact with welfare services, and 100% being in the case of a disaster, be that environmental or health. And we had started these discussions about 3 years ago, prior to the current disaster and bushfires that we have had. The other thing that we really need to consider with food insecurity and this issue is that there's a significant social and health burden that is related to food insecurity. We couldn't measure it in Australia because we don't have that sort of monitoring, but we can see it. And our research shows us it's around obesity, diabetes, trauma, distress, and particularly important, poor child development. Next slide, please. The other thing that is really important is to really have a think about what the consequences of long-term 7 years of food insecurity are likely to be on the people who are food insecure. And the obvious ones are malnutrition and fatigue. There's also relationships with poor mental health, and that may be something that leads to food insecurity or as a consequence. So, you know, the psychological distress, anxiety and trauma related to being food insecure and not being able to provide food. The weight changes we've discovered as we've measured population subgroups can be weight loss, overweight or obesity, and they're all linked to chronic health conditions. And long-term, in other countries, we know there's a reduced life expectancy. Next slide, please. So we also needed to understand who's more likely to experience food insecurity in Australia, and this was part of the data that helped with developing the index. So our data shows us asylum seekers, people who are homeless, Aboriginal and Torres Strait Islander people, people in remote and regional communities, single parent families, welfare recipients, young adults, and low to middle income families if there's some sort of shock to their income, and people with disabilities. Next slide, please. So all aspects of food insecurity are usually related to poverty and financial hardship. And this is particularly important now because we did have pre the COVID pandemic a significant proportion of Australians who are below the poverty line, and the poverty is primarily related to inadequate income, or underemployment, and also to the cost of food and utilities, and a change in circumstances such as accident, death in family, relationship breakdown and job loss. And you can hear all of these things are even more relevant at the moment. Next slide, please. So given the things that are related to an increase in food insecurity, the picture on the left is the current unemployment rate in Australia, and you can see there's been a significant increase as a result of COVID. There's also been some preliminary research looking at the coronavirus supplements. So the government has put in a lot of social protection measures in Australia to support people through this period of time. And people have described that with the additional supplements to their income, that they've been able to afford food and afford food that is healthier than they've been able to do. So actually, you know, the number of people skipping meals has gone from 75% to 33%. So some of the things we were advocating for previously, we've been able to show. There's no data at the moment specifically around disability in Australia, but yeah, we can look into that. Next slide. So as part of understanding the problem, we have done several surveys looking at the cost and supply of food, and it's a representative sample, and we're looking at the cost of healthy and unhealthy foods. So that's one of the elements that underpins this project. Next slide, please. I thought it might be useful just to see, until we've done this survey, we had never located the food retail sector in WA, and also the little brown boxes are the remote community stores. So you can see that a lot of, a big vast area is supported by smaller independent stores. Our food costs survey showed that healthy food basket prices really depended on where you lived, and they were up to 26% more in remote communities, and that the average weekly household expenditure on food is, at the time, 2015, it was 16% of disposable income. So there was a good reason to look at the risk of food insecurity for people who were needing to spend more than 15% of their disposable income on food each week.
Thank you, Christina. And I see as you were talking, Christina, there was a question that came up in the chat. I'm just wondering if it's possible to get that up again so that you can see it.
I think it was around disability and food insecurity, and I actually haven't seen any recent data in Australia around that. That's but there are small pockets of data, I think, that suggest that.
Okay, thank you. Christina has given that overview of the issues around food insecurity and how that connects into our work. And now what I'd like to do is introduce you to Tim Landrigan. Tim is currently doing his PhD at Curtin University, researching social determinants of food inequality and food stress. And Tim developed the food index as part of his research. And so he's going to demonstrate that food index, food stress index tool for you in more detail. So Tim,
okay.
Thank you.
Thanks, Helen, and good afternoon, everybody. So as Christina mentioned before, food insecurity occurs when people don't have physical or economic access to safe and nutritious food to meet their dietary needs. And there is also research to show that food stress occurs when a household needs to spend more than 25% of their disposable income on food. And so households at risk of food stress are vulnerable to food insecurity as a result of inadequate income. This doesn't mean they're suffering food insecurity, but they are vulnerable. And there may be just that one thing that pushes them over the edge. For example, it may be an increase in their mortgage or rent payments, or for example, as we're seeing now, if they lose their job due to businesses being shut as a result of a global pandemic. As we're experiencing now. As a result, we're seeing people who are now food insecure who normally wouldn't be. Next slide. So currently there are a number of different measures of food insecurity and food stress. The single food security question we see on a lot of surveys in Australia that says, in the last year, my household ran out of food and couldn't afford to buy more. However, this is only one indicator of how households are suffering from food insecurity. Socioeconomic status is also used. For example, the ABS Socioeconomic Index for areas. It is used to assess the socioeconomic status of geographic areas. However, there are no food cost variables used in any of those indexes. Food affordability is normally measured through market basket surveys, and such as the WA Food Cost Survey that Christina mentioned earlier. These surveys normally calculate the proportion of income a household spends on a hypothetical weekly basket of food. There are other factors that are also associated with food insecurity, such as Indigenous status, household income, household expenses, unemployment rate, etc. However, previously there has been no single measure or indicator to measure food stress on a geographic basis. Slide, please. So what is a food stress index? So due to the lack of a single measure, as I described in the previous slide, developed the food stress index. So the food stress index is a simple indication of the potential for food stress of households in a geographic area. It encompasses all aspects of food affordability and food insecurity to provide information about the likelihood those households are food insecure. It is a similar concept to the CIFA indexes from the ABS, and it is based on the same methodology. It uses readily available data that is updated regularly. For example, the census data that is available every 5 years. And it is also available at small geographies, like the statistical area 1. This is so that the food stress index can be updated as these other data sets are updated. And we can also use the food stress in other statistical area 1 as a building block to create other geographies. Next slide. So the variables that we considered, some of the variables we considered are listed on the screen. So research is saying that these sort of variables can have an impact on food insecurity of households. So we've got household demographics, and the size and the composition of the household does have an impact on food insecurity, as does the Indigenous status of the household. We've also looked at household income. So we've got the lowest and highest quintiles of the household income. And this is so we can create a range of scores that range from those low income houses up to the high income households. Next slide. We've also got food affordability. So this is the proportion of income required to purchase the healthy meal plan, and this data is taken from the West Australian Food Access and Cost Survey. New variables that some people may not have seen before that we've started using are housing costs. So we've got median monthly mortgage payments and median weekly rent payments. We've also got the unemployment rate. Okay, so all the data was prepared at the statistical area 1 for that, and all the variables were derived as a proportion of households in each SA1. Principal component analysis was used to reduce these number of variables to a set that summarises the information and allows for easier analysis. This reduces the variables to those that are most meaningful. You can then use these to create a set of weighted raw scores, one for each SA1, that can be scaled with a mean of 1,000 and standard deviation of 100. This produces the food stress index scores for each statistical area 1, which can be ranked in order from those least likely to suffer food stress to those most likely to suffer food stress. Indexes for higher geographies are constructed using populated weighted averages of these statistical areas 1. So we can create statistical area 2, local government area. Next slide, please. So this shows the results for Western Australia by statistical area 1. These on their own aren't very meaningful. And they don't have a name, only a reference number. But they're basically the building blocks for the other indexes. If we go to the next slide, you can see how these translate to local government areas. So we've got here the quintiles, and so for the local government areas, the scores range from 840 to 1209. And the lowest score is for Peppermint Grove, so that means those households are least likely to suffer food stress. And the highest score is Sandstone, which is a very small local government area in the middle of nowhere east of Geraldton, which has a total population under 100. And I'll show you these later when we do a demonstration of the maps. So how do we estimate the number of food stress households in an area? So we can make an assumption based on the normal distribution curve. And since the mean for this is 1,000 and the standard deviation is 100, we can easily do this, as you can see in the normal distribution chart on the right. So those areas around the mean food index score, we have around 50% of households in those areas that are potentially food stressed. Starting with this, we can then use the standard deviation either side of the mean to estimate the proportion of households in each area that are food stressed. This means those towards the left tail in the green area, around 2% of households are food stressed, whereas, for example, in Peppermint Grove, whereas those at the other end have around 98% of households that are at risk of food stress. For example, Sandstone or remote north of the state, we've got Halls Creek. As I mentioned before, this doesn't mean that these households are food insecure or require food relief. It just means they're on the verge of having to spend more than 25% of their income to purchase a healthy meal plan. And the COVID pandemic may have pushed these people over to the edge. So now we'll just do a quick demonstration of what these food stress indexes look like. So hopefully this will work. The share screen. Share screen. Okay, so what we have here, let's just start. So this shows the food stress index for Western Australia by statistical area 1. These green bits, this is some of these are national park areas, so that's why they look green. But most of the remote areas you can see are red, which means they're on a scale in the decile, the highest decile, so 10. And if we look up here, we can choose a local government area. So for example, if we go to Perth,
The capital city.
the capital city, yes, for those people from not in Western Australia. Apologies for the time lag. So this shows Perth, and you can see the streets. So this is around the river. So when I was talking before about the two SA ones that are the highest and the lowest, Kings Park, which is the large park on the river here, is actually the lowest food stress area in the state. Probably understandable because not many people live there. Whereas the highest food stress area is over here, this red one, which is along the railway line in the city. So if we choose another area somewhere that people may know, so if you look at Augusta Margaret River, which is the wine region, so you can see here, this map shows that for Augusta Margaret River local government area, it's about the middle. It's in the middle quintile. The food stress index is about 1,000. But within Margaret River, there's a great range of different areas that are on the scale. So we've got here, this region just east of Margaret River is food stress index of 9, decile of 9. Whereas over here, right near Surfers Point, got food stress indexes down as low as 4 for the decile. And so using statistical area 1, which these little areas are, within the local government area, we can see the diversity within an area of the food stress index. We'll just go another one. This is near where I live, so one group. And it's another area you can see there's quite a range. It goes from places along the coast, which is understandable, richer suburbs on the western side have got such a low food stress index score. But then somewhere in here, you can see some of these areas have got high scores. So that's where the statistical area 1 is very powerful, is to be able to identify these local areas. So one of the things, since it's a geographic, we've geocoded, oh, we lost the connection. Since we're geocoded, we can add other data over the top that is geocoded. So what we've got here is the job seeker. So job seeker is the Australian government's unemployment benefits, which was introduced in March 2020 as part of response to COVID. So what we've got here, the colouring here is the proportion of household people eligible for job seeker, which is available for people who 21 to age pension, 22 to the age pension age. And so you can see here up here in Halls Creek, the food stress index is high, it's in top quintile, but also we've got 30% of people there are on job seeker. And if we go down to the bottom corner of the state, if this works. We can see within the local area, these areas around Mandurah and Perth. So here in Mandurah, we've got 22% of people are on job seeker, and the food stress index there is pretty high as well. So this just means that these are the sort of households where people are suffering food stress and may need food relief. So this data is from March. If we skip forward to June, we can see there has been a change. So up here in Halls Creek, now there's 35% of people are on job seeker. And you can see across the state, the colours are getting more orange. So if we go down the bottom again here, I think Mandurah's gone pretty high. So then Mandurah's 30% of people in Mandurah who are eligible for job seeker are on job seeker. And then 19% there. So that just demonstrates, go back. So that just demonstrates how the food stress index can be used geographically to map not only the likelihood of households suffering from food stress, but we can look at other variables such as job seeker. And that's all from me. Thanks.
Thank you, Tim. That's and hopefully people were the gaps in the internet connection haven't lessened your appreciation of the amazing work that Tim and Christina have been involved in that has pulled all this together. We can see that there are some questions that have come up on the chat. They've just disappeared from me again. And I'm just wondering whether there's any of those that are specific questions that our panellists can respond to. But we also do have some specific questions that we want to ask of you. But I'm just wondering if there's any of those questions that you're able to answer now before we move on to our questions.
Yeah, so I can cover, there's a question there about how disposable income is defined.
Yep.
So that is taken from the Australian Bureau of Statistics census data from 2016, and it's the median disposable income for a household based on the statistical area 1. Hopefully that answers the question. And there's a couple of questions there about the tools being available publicly. At the moment, that was just for the demonstration purposes, but we will be looking in the future to get those available.
Yeah, we're trying to find a way to make it available, and to make it available at least Australia-wide. The other thing is, if people are really interested in what's behind the tool, there's a journal article, The Protocol for the Food Stress Index, that people can access as well.
We could probably share that with participants after.
Yeah.
Yeah.
Yeah, the link's in the slides.
Right.
Yeah.
Okay, so there's we will be able to respond to some of those other questions as well. But Lockie, we had some questions for people on the webinar.
Yeah. So what we're particularly interested in, folks, is well, I'll explain how people have used it in a second, but maybe in the chat, if you could tell us how else you think this might be applied, and what other additional information may be useful. If you could put that in the chat, that would be very, very helpful. And while you're doing that, I'll just read or explain 3 examples of how the tool is being used. And essentially, the first example comes from Second Bite, and Jim Mullen, who's the national CEO, said that they've used the combination of the food stress index and a healthy food basket to identify at a postcode level, and more granular than that, where the need is actually needed in a geographic area. In response to COVID, they've spent $2.4 million worth of food procurement, which determined not only the proportion of food, but different quantities of food types. And I thought this was fairly interesting. Jim said that essentially it meant it allowed Second Bite to spend smarter, waste less at their end, respond very intelligently, and in the end, it cost less to provide more service. It's a practical tool to shape their response to any emergency. St Vinny's, Andrew York, who's the Executive Director of St Vinny's Membership and Volunteering. The week before COVID, St Vinny's and Andrew approached the City of Stirling, and they used the food stress index to identify the need of food within the City of Stirling, which is in the northern suburbs of Perth, to work out where the need was, basically suburb by suburb. And then they built hampers using the food stress index and the healthy food basket to work out what the size of the hamper was in terms of household demographic makeups. They had different proportions, and particularly Andrew indicated that they then built enough food for 7 days, and not just breaking the need for at 1 or 2 nights. It's a 7-day healthy food basket. And Food Bank, Rosalind Giglia, the manager of the Healthy Food for All team out at Food Bank in Perth, they used it particularly, they've had a mobile food van which goes directly to where the need is, and they've used the food stress index. They get a lot of anecdotal evidence about where the need is, but what ends up happening is it allows them to cross-reference the anecdotal evidence with an evidence-based approach.
Okay, could I just, we've had one participant who showed up on our screen as raising their hand. Unfortunately, because of the number of people who are registered for the webinar, who are part of this webinar, we're not able to have the ability to go to you and for you to come on the screen, and so we're asking people to put up in the chat if you have got a question or a comment. And I will say to you at the end, the final screen will give you both Christina and Tim's email addresses, so you will have to contact them directly. I think it's important though as well, given a number of the questions have been about how can people get access to it, and Lockie, you've given some examples of where people have used it. Just to kind of reconcile that for people, the examples that Lockie's provided are from members of our food relief project group. So we're still piloting it in a sense of refining it, looking at the ways that it can be used. And so I didn't want some participants on the webinar who were saying, how can we get access to using it, to think, well, how come others have? So these are all people who are involved with the work to date, who've been, in a sense, testing it out. But there are some questions, perhaps the one about the significance of 25% of household income.
Do you want to do it?
As the cut-off figure?
Well, at 25% of household income based on other components of household income, that was a level that was identified by the research. And I guess with developing the food stress index based on that, we've done some face value testing. So we've taken the index to the services and people who respond to food stress and offer food relief services, and they are the areas where people are requesting or accessing services. So there's both a theoretical basis for it, and you can have a look at that in the journal article, but there's also a face validity test, if you like, with us developing this tool. Can I just answer? I might answer another one, another question. So people in Western Australia can contact the Food Relief Framework or Tim and ourselves and use, we can work with you to use the information. We are trying to access or to work out how to make this available in Australia, and Tim's done the groundwork in terms of the demographics and everything for that. But as many of you have highlighted, it needs to be on a public available platform, and so that is something that we're trying to look at. And I did see the other question there around, if you plotted services that are available against food stress in an area, that would be quite useful. And I think it would be really useful. I agree with the person who raised that. What we found though is any data we can put any data on a geographic map as long as there's a postal address associated with the data. So if people tell us we've got 12 soup kitchens and they run on the corner of this street and at this venue, we can put it on. When we went to access this type of data initially, it was more about where the funding bodies sat and which organisations had it. So this tool has a lot of potential for a variety of different applications, and as long as you've got the data, in terms of the location, the data can be plotted. So I think
any geocoded data we can add. So there was a question there about including mortgage or household rent stress, and so that's something else we've been looking at adding to overlay on top of the map. Just to answer, there's another question there about does the tool take into account the cost of food in different areas? So yeah, the food access and cost survey was done across the state, and as Christina mentioned earlier, so food in remote areas costs 26% more than it does in Perth. So we included those food costs in the actual proportion of income needed to purchase the food basket.
And I guess following on from that, food costs, we thought that at the beginning we were told they didn't vary, but when we did a representative sample of retail, we saw them vary quite a bit, particularly healthy food. And so in order to make this available in other areas, we would need to have food costing surveys. And I know that Queensland and Northern Territory do have some surveys. So it is possible for this particular tool to be expanded, and we're looking at a quick, I would say quick and dirty, but I don't mean that, way of collecting the costing data, because it's more than just the 6 foods in a basket to see what's happening to the cost of living. It's that a group of foods for basic healthy food baskets.
I'm wondering if I can perhaps also add to this conversation in terms of that question about the food relief services. And people may not appreciate that both the two major funders of food relief, the Federal Department of Social Services and the State Lottery West, both sit on our food relief framework working group, and so they've been very active participants in this. And certainly these kind of issues have been discussed, which has led Lottery West, for example, to do an analysis of their grants that have gone out for food relief by region. So they've been trying to, in a sense, pick up that very question that the person asked about being able to look at where the food relief services are, notwithstanding the issue, Christina, that you've raised, that it tends to be based on the geographic location of the applier.
Yeah.
And Jenny, you wanted to address this issue about the job seeker.
Look, I think just very briefly, Rebecca, it's a really good question. What we've seen during the pandemic is we've seen the provision of food relief pivot really from the usual groups that we have supported or the sector supported, who have seen an increase generally in income, to newly impacted groups such as those on temporary visas and a range of others, which I'm sure you're familiar with. So we expect, of course, food stress and food insecurity to increase in September, and that the need for food relief to actually escalate quite quickly around that time.
Ashley, could I ask you to put the acknowledgement slide up, because I did indicate to people that that does have both Tim and Christina's email contacts, and both Tim and Christina have been very generous with their time in terms of responding to requests from people for more information about that. So we acknowledge both the contributions of both Tim and Christina, and as you can see there, we wanted to also acknowledge the Department of Health, which has funded the facts survey, and the involvement of local government environmental health officers and health promotion officers. And I would, just as we're finishing, before I ask for any final comments, just indicate to people that, as I said, this is a two-part series, and the second webinar is being held at 1 o'clock West Australian time on Friday the 14th of August. And that webinar will explore the food stress index in more detail in terms of how it's been used to assist with food relief prioritisation during COVID. We'll be able to show to you in detail how the tool could be used to quantify the types and amounts of food for food relief and disaster management. And we will share some of the lessons learned to ensure that safe and nutritious food is available for people who need it. And again, going back to that last question, one of the things that we've been very keen to do is look at the lessons learned and how that can feed into our response come September. Any final comments, Christina, Tim or Jenny?
I would just, if you are interested in the translation of this tool to emergency relief for a variety of opportunities, then come along to the next seminar, because we've done a lot of work with different food baskets for different reasons, and the tool is very powerful in assisting people to identify and locate the food relief response, I think. And it's something that we were forced to do, weren't we, Tim? by the food relief framework. So it's quite a nice follow-on if you're able to participate.
Thank you. And we will be sending out the details of that second webinar to everyone who has joined this webinar. So we look forward to joining with you in this discussion in a couple of weeks' time. Thanks again to everyone who's participated in today's webinar, and thanks again to our panellists, Jenny Gray, Christina Pollard and Tim Landrigan. Thank you.
Thanks.